Social Care Online, produced by SCIE, the Social Care Institute for Excellence, is the UK's largest database of information, resources and research on all aspects of social care and social work. This freely available resource is for all social work practitioners, student social workers and anybody working in the social care sector.
Social Care Online is a tool which supports education, training and development for anybody in social care. It includes references to social care resources and full text, legislation, government publications, research, systematic reviews, digital media and learning materials.
If you're compiling reports, undertaking systematic reviews or providing up-to-date UK-focused information for practitioners or key decision makers, Social Care Online is for you. It's free, updated daily and easy to use.
At Skills for Care, it's very important that we've got access to free and trusted information.
It's incredibly easy to use, the drop-down boxes are excellent.
It's important to me that Social Care Online is free, especially with the current climate, and I'm a student. It's nice to access something that is free.
It's really important that the information is up to date and reliable because things are constantly changing in family justice, obviously since the Family Justice Review. It's very high profile in the news, so we need to keep our practitioners up to date, and that's incredibly important.
At Skills for Care, Social Care Online supports us in raising our quality and standards, as we're able to use it as a trusted point of information. It contains a wealth of information, knowledge information, best practice that we can then signpost to our employers and also our internal colleagues.
Social Care Online has a number of key features that make it easy to use and supports many different functions. It includes an easy-to-use Google-type standard search, a more complex, advanced search option. There are easy-to-access drop-down filters that includes a filter to access freely available resources. Materials are available in many different formats, including video, and you can set up email alerts for specific subject areas. Results can be saved or exported for further use, and Social Care Online incorporates many other useful features.
Social Care Online is really valuable because it includes grey literature. A lot of search engines don't include this, so it means you have to do additional searches, but with it being specific to social care and including grey literature, it means that for our evidence reviews we get the information that we need.
The fact that Social Care Online has the filter for free resources is probably one of the most important things for us. With the Better Health project, we try and compile resources from other organisations that are free to access. So with Social Care Online you can tick a box that allows you to just show the free ones, so we're not ploughing through all these paid-for articles beforehand.
I think for me, the information is clear and easily accessible, and it covers a real wide range of practice as well. My background is learning disabilities, but in the last couple of years our services have gone generic. So in terms of like filling gaps in my knowledge around services for older people, I've been able to find information around practice issues and areas within Social Care Online. And the videos, we embed those into our presentations because that's another visual learning aid for people that perhaps find it harder to take information in through listening.
Simply creating your own free account and login allows you to access additional features, including the advanced search option, registering for email alerts, saving searches and downloading search results.
The particular features of the search on the Social Care Online that I like is you can go into the advanced search and really search for what you're looking for.
We really like the fact that you can download results, so for people who don't have an account it's really useful if they get one and get to learn to use reference management software, because that allows you to collate your results from Social Care Online. So within a matter of a minute or so you can be downloading 500 records from Social Care Online to browse at your leisure rather than having to go back and repeat the same search again and again.
Well, for me as an academic, normally when I need to use it or I'm looking for resources, it's about whatever I'm teaching at that time or whatever's current. It's something that supports the curriculum material. It supports it very easily and naturally as well. So I would encourage students to link with it.
I've used Social Care Online in the past for research for my assignments, and I've also used it as research before I went on placement to get an idea of the kind of work that I'd be doing.
I use Social Care Online to help me with conducting evidence reviews. Also as well, at Skills for Care, we've got an online resource called the Research Knowledge Base, and we use it to conduct searches to populate our research knowledge base.
When we first get a topic, we need to know what the key themes are in that area, and we might do a quick search there using the filters to see what systematic reviews, what policy documents, what grey literature is out there. When it gets onto the systematic reviewing phase, then that's when we'd go into the advanced search feature and really stack up quite a complicated multi-line search, and then we would find absolutely the most information that we can, extract that really quickly, really easily, and then get on with our systematic reviewing.
I use Social Care Online particularly for my own personal development. I found it very, very useful for my own sort of academic work, recently completing the post-qualification, and thinking particularly of some of the guides that have been useful around personalisation, for instance, and having to use that and to critically reflect really upon the personalisation process.
Personally, I think it's a fantastic resource. It's really useful in the sense that it's developing me personally. It helps me with my CPD, my continuing professional development. So it's about taking the step forward really in terms of my development.
I think as a newly qualified social worker, you are obviously still building on your knowledge and your development, and so when I first joined the team, I hadn't got much experience of safeguarding, so it was useful during those times just to quickly go online while you're at work and just have a quick look just to make sure that you are following the correct guidance and policies really.
And I think that the way that we use Social Care Online means that we're making social care evidence available to key decision makers. And as the integrated care agenda becomes increasingly important, we're presenting the evidence from Social Care Online and embedding it within social care, public health and the clinical evidence base.
I do think I will go on using Social Care Online when I leave university, especially with the new Care Act coming in, that will come into practice when I graduate. It is useful for current practice. I'm always going to be learning and social care is always going to be changing. So it's useful for me to go on to Social Care Online.